Hey, this is another section of CSL, that is the intramuscular and subcutaneous injection. Intramuscular means once we treat the patient, we give medicine many ways, either orally, through snuffing, through the respiratory tract, or through subcutaneous injection, or intramuscular injection, or intravenous injection, or parenteral through deep veins, or sometimes scalp vein. So pediatric is a special one. And other than that, enteral feedings like nasogastric tube, gastrostomy feeding, jejunostomy feeding, so many ways not to put in, especially some patches as well. Analgesics, from the patches secretion they absorb through that, and even sometimes instilling into the eye. Sometimes PP under the tongue, nitrite and so on, absorb and have the action. Okay, there are so many ways among these. So subcutaneous and then the intramuscular injection. For that, we do need to know a little bit about ganglia neura. This is the gluteus maximus muscle, gluteus medius and gluteus minimus. Underneath this one is the sciatic nerve. That's why when we are going to do injection, intramuscular injection to the buttock, better to avoid this sciatic nerve. Okay, for that, once you are going to inject here, we have the marking. So when you make this buttock, we make into, okay, 4 quadrant. So better anterior, upper, this is the place. If you inject here, it may hit the sciatic nerve. So for that, this is the usual area we have to inject. Okay, for that, come on, somebody come and hold. Okay. Now before that, we have all the equipment here. So usually we use something like 5 cc syringe. Okay, now this one is 3 cc, never mind. Okay, usually, size 23 is the best. We have to wash our hands, put on the glove, and then put on. If it is easy to suck, it's alright. We can use still the sucking needle. Okay, I'm going to suck here. So for that, look at the way how I keep my fingers. Every finger is utilizable. Okay, here now I'm going to suck the contents from this, assuming that this is the medicine. Okay, where without touching the margin, now you see you hold with these 2 fingers so that you can just suck simply. Okay, something like maybe 1.5 or something like that. Okay, finish. Keep it. Now here some pocket of air. So you pump up a little bit. Okay. Now it's about 1.5 plus. Never mind. So this is the content. Now you are going to inject. So I'm going to take the spirit swab. Assuming that, so this is the swab. Here I'm going to swab. And patient I have to 1. I'm going to inject. Okay, like other time, all the 6 steps, introduce yourself, greeting, whatever. Now after 6 steps, now there may be a little bit discomfort, little bit pain. Don't worry, I'll be very gentle. And the way I inject, there may not be pain. That is my usual way of routine. Okay, let's see here. 1, 2, 3, 4 already in. 1, 2, 3 means patient thinks that I'm just poking. But 4th time, the needle is already in. Okay, I suck out. Make sure that the needle tip is not in the artery or vein, so no blood may come in. By that time, you can pump in. That is a way. But for you all, don't practice my way. I've been doing thousands of, that's why I'm very confident. So for you, just do that, okay, ordinary way. But what you should know is, the pain is when you are touching this needle to the skin. Or if you keep there, paining all along, isn't it? Okay, puncture it, not much. That's me. When I do, so I adjusted already. 1, 2, 3, 4. Okay, perpendicular, well adjusted. Never mind. whether you want to do it or not, your choice. Okay, done already, you injected already. Afterwards, we pump and then sometimes we massage. Okay, this is IM injection. So, subcutaneous injection. Where do we do? Around the umbilicus. For the diabetic cases, subcutaneous insulin and so on, or around the thigh, or around the shoulder here. So for the IM, we can do buttock, lateral part of the thigh, deltoid, and then this trapezius muscle, something like those are the areas we can do IM. So for the sub-Q, sorry to show you here, being mannequin, wow, the skin is very tough. Not like us. Like us, we can just pinch the skin. Okay, Hari, come. Never mind, don't be. Just give me your, okay, forearm. So something like, I'm going to test antibiotics, penicillin, whether he is allergic or not. I'm not going to inject now, don't be afraid. So I will be doing this way. Okay, spirit swab everything with the glove hand. So pull up here and then I inject under this. Now I'm pulling the skin in my pinched area. So once he inject, sure the needle tip is at the subcutaneous. Now that is subcutaneous. Another one is we can still do intradermal injection. That means just as it is you inject and when you pump little bit you see something like border range effect popping up. Those are the intradermal, especially we use for BCG vaccination. What is BCG? Bacillus calmette-guerin. So those are the attenuated tuberculosis. Okay, that's how we do subcutaneous. Okay, done. Thank you very much. Close it.